Good morning. Welcome to Speaking of Animals. I'm Amy Cartenuto from Flagler Humane Society. My special guest today is one of my favorite people, Dr. Frank Caporali, who comes to Flagler Humane Society from New York. He came down here attempting to retire.
Attempting is the word.
But we found him and we said, no way. So he is one of our doctors at the Flagler Humane Society, and he helps a lot of people and their pets at the shelter. So we're going to talk a little bit about that today. My other handsome guest is Billy. Billy is a terrier mix, about a 55, 60-pound terrier mix. He's 6 years old. He's a very good boy. He rides super well in the car. He's house trained. He's good with kids. He's good on the leash. He's just a nice boy. So once in a while he likes to talk. So at some point, I think during the show, Billy will probably speak a little bit for us too. But so Dr. Frank, you and I were talking about how people can kind of do a head-to-toe exam on their pets and learn a little bit about.
And that's what we'll mention. It's also been a pleasure being down here, retired, and working at the shelter, because the shelter is wonderful and beautiful, and I feel like I'm contributing to the pets most importantly, and to the people that adopt them. It's a wonderful feeling, so I can't lose that. And Amy and group staff have been terrific. So what we do is, basically, I'd like to just let people know that what we talk about right now is just the procedures that a veterinarian does in an office that you could do at home. Simple things to give us a handle on what's happening to your pet. And basic observations are our biggest medical procedure, how our dog is doing, what they look like, and whatnot. So on a quick note, I'll just tell you, things like ears, teeth, feet, bellies, body, it's easy to observe something that shouldn't be there. And what I tell people is by looking at the dog's head on by their face, the facial expression, and their eyes, see Billy's saying hello too. We can judge our dog or our pet, whether it's cat, dog, any animal you may think of, how their disposition is, what they're looking like. Their eyes are nice and bright and alert. That's what I want to always see. Any changes can indicate something's not correct, and that's what we have to be aware of. It helps us out. As veterinarians, in our short exam, we can't go into all the details that's happening. So what I tell people, if you want to see if your pet has bad dental disease or any issue with the mouth, simply massaging the jaw from the eyes to the nose, or from the nose to back to the eyes, just squeezing the upper mandible with your hand, put a little pressure to the lips, will tell you if the pet has any kind of discomfort in the mouth. If they wince or do anything of that nature, that might indicate that there is, as he said, he will talk. And actually, Billy has no problems at all. But by palpating their jaw and their mandible, the maxillary area we call it, the above part, it could let you know if your pet is any distress. And that's what as a simple thing. Trying to open the mouth in a pet sometimes could be difficult, but if you can, looking inside at the mouth and tongue is another procedure that's simple and easy to evaluate how they're doing. Obviously, one of the main things...
Billy's got good lungs.
He's got a little good. This guy wants to have. When he's at home, he's ready to go out there. One of the main things is how our dogs eat or our cats eat. Are they chewing food correctly? You see them having issues. Is they drooling? The little things we may not notice because in a busy household we can't see these issues. But that gives us an indication of what's happening. Obviously, in the professional setting as a veterinarian or a technician, we could get a little bit better look in those mouths. We have a little more technique to see. And in that case, if you're unaware of what's happening, a visit to a veterinarian would be a good idea, just to let them evaluate a little more than you could your own pet. The other thing we palpate or look on dogs is just running our hand along their body. If we feel any all of a sudden lumps or bumps on them, where does this bump come from? If they go outside, they can get a little irritation. They run into a plant. He's really talking with really
he's hijacking the show.
He's taking over. But what we do is we feel our pet because they can't go outside. They can get an insect bite. They can get stuck on a thorn plant or something, and a little bump could develop. We want to know what's there. We'll try to speak around Billy, which is wonderful because he's feeling so wonderful here. I think he's jealous. He wants to be here. Yeah, Billy, and incidentally, Billy has the short-haired coat, which is wonderful because it's very easy to palpate any kind of issues with a pet like this. If he had anything on his skin, either a bump or tick, let's say, it's pretty obvious you'd feel it. And those are things we want to address. Somebody sees something, it wasn't there yesterday, we want to know why it's there today. And that might be an indication of something occurring. Other things that we do is that their feet are on the ground constantly. They're walking on their feet. Imagine us walking barefoot 24/7 on any kind of soil. I mean, I have a hard time walking in my house with my shoes off. So the thing is that looking at their feet periodically, both cat and dog, just checking their paws, between their paws, there could be issues that we're not seeing. And they'll walk and they'll compensate for it because they're meant to survive. They're not going to sit there holding their foot up, limping in the wild. So they kind of go with it. But picking that foot up, looking through the paws once in a while, especially here in Florida with sands, grasses, things of this nature, we'd find out if anything is bad or wrong with those feet. And it's just a pretty easy thing to do. In fact, your dog would love it. They give you their foot. They would love you to have touched their feet. If they're very sensitive about it, pulling their feet away constantly, might indicate something's not correct, and that might require some kind of addressing. Soaking the feet once in a while with just a little warm water and a doggy shampoo also makes them feel good. Like us washing our hands. So, yeah, it's like a spa treatment. And it helps them out once in a while because those feet are constantly on the ground. They don't really wash their hands like we do. So it's something to consider. And simple things, if they resist these issues or movements, something might be wrong, and that would require addressing it. And that's what the professionals are here to help you out with. Very simple to prevent things from occurring. I was mentioning the teeth before. In a dental issue, looking at animals' teeth, cat, dog, rabbit, whatever you want to call it, it's easy to catch things very easily when there's not a problem. When the problems get worse, it becomes more difficult, loss of teeth. So in the field, we have a veterinary dental procedure we do. It's cleaning a simple tooth, just cleaning a tooth. It's wonderful. Cleaning it fine. Waiting down the line, it might require dental extractions, more discomfort to the pet, if you want to call it this. But we can catch it before it becomes that way. It's like going to your dentist to have routine cleaning rather than a cap or dental or a root canal. So those are issues to look for.
Even like what you were saying about the exams and looking at their feet. If you start, messing with your dog's feet when it's a puppy,
they'll love you.
They like it. Yeah. But if you wait until it's an adult dog, sometimes they don't want their feet touched, and then it's more of a hassle. So if you have a young dog or a cat,
start doing it regularly. And one of the other things next thing I was going to tell you about is Amy's rubbing my little baby's head over here. The other thing you look for is the ears. You should be able to take your finger, put it in your dog's ear, and just rub it around. Just in the outside, just rubbing around. It should feel good. You do that to my ear, it would feel good. So
we're not going to do that.
We're not going to do it, but it makes them feel, and that's they love it. You do cats. It's the cat's special spot. If I have to examine a cat, the first place I start rubbing is between their ear and their face. They fall asleep and you do that. It's very comforting to them and it doesn't hurt. Now, if you do that and they're really uncomfortable with it, that tells you something is not correct. And those are the issues that I'm getting at. You rub those ears on a pet, that's an affectionate area, and we could address that as a problem should there be one. Mm-hmm. I tell people sometimes with a little piece of dry cotton or a gauze, just rub it inside the ear. Nothing fancy, no medicine. Because the ears will sweat, and if you just go in there and a little debris comes out, just an ear wash maybe once a week or two is all you need to do. And it catches it before it becomes a problem. The same as we do ourselves. Mm-hmm. But they can't tell us this.
Right.
And we want to catch it before you come in for problems, and I don't want to address problems. I like simple things. We don't want to have problems.
Yeah. Well, and part of an exam, too, like for pet owners, I think we would say to smell the ears, smell the breath. Right?
100%, because those are the things that say, wow, why does my dog have this odor all of a sudden, or what's happening? Those are the keys that get us. And a lot of times we come into our office, there might be odors on the dog, they're nervous, or the dog, and we can't, in that short time, develop it. If you say, geez, I noticed his ears have been smelling for the last week, that tells us something pretty significant. Yeah. Or we can catch it before it becomes a major problem.
For sure.
And we really, as my own medical doctor said, you want prevention, not treatment. If we can prevent these issues, it makes it easy for everybody. Dogs live a long life. We go nice and simple. Some of the issues that come in listening to the heart or a stethoscope as a physician or a veterinarian would do, we're listening for other issues that might be occurring. In most cases, dogs with those conditions, heart issues, respiratory, are going to show you signs. If my dog doesn't want to get up, he can't walk, he's having why is this all of a sudden happening? Is there something occurring? That addresses it to us.
Well, I think Billy is saying it's time to take a break.
He's with him. He's telling us he needs a break.
We'll be right back.
Thank you, Billy.
We'll be right back. Welcome back to Speaking of Animals. I'm Amy Caratenuto here with Dr. Frank Caporali and Billy. So now we decided we're going to talk about poop now. Does that sound like fun? Everybody want to listen to
one end to the
talk
other.
About poop? Yeah.
Well, as Amy points out, that the fecal defecation, urination on pets is a very important thing to notice. We let our dog go in the backyard. We may not observe what they're doing. If our dog is naturally doing what nature has them doing, there's no issues, we're happy with this. If you notice your pet has trouble doing it, down, straining, maybe a little more difficulty in it, it might indicate other underlying issues, anal problems, anal gland problems, orthopedic problems, spinal problems. And these are things that, again, observation is the key role. In our veterinary office or clinic, we can't see them doing this. Don't have to say, Jim, I notice my dog has trouble going to the bathroom lately. He's urinating. My cat's going to the litter box too many times. What's happening here? It's easy to miss it, but we want to check those issues. And that gives us an important sense of how our pet's health is. And just following even the consistency of what they do, as unfortunately that people don't like looking at this, if they're normal, if all of a sudden my dog's straying, all of a sudden there's blood in there or this, I want to know that. And those are things to look at. Mm-hmm. And they'll tell us this. The dog will tell you, or a cat will tell you right away something's not correct. And these are the little issues that we want to address.
For sure.
And it's very important, especially as the dogs get older. We see more of that happen with arthritic changes, spinal changes. Mm-hmm. And again, we could try to help it before it becomes critical.
Yeah, with the younger dogs, we see when we're talking about poop, we see a lot of parasites, intestinal parasites. So we see that a lot in the younger dogs. And then, like you say, in the older dogs, sometimes it can be a more serious issue.
A very serious issue. And the point is that a lot of times people come in, we always recommend a fecal sample at least once a year. The reason being is that we take a lot of these medicines, heartworm pills, preventatives, and they're all wonderful products. Everything is working out there. But there could be a gap sometimes, and we want to know that. Parasitic infections in the household aren't what we want to have, because that could lead to issues also for people. So a fecal sample once a year confirms it. You're not going to see worms in the dog's fecal material. That's the rarity. Most of them are just the eggs coming through. So that's microscopic. So we want to make sure that we're not missing anything. Okay, and that's a real important thing. That's, again, subtlety in animals.
Yeah. So when you make an appointment with your vet, whether it's with
Bring a
Flagler
sample
Humane
with
Society,
you.
bring a gift.
Bring a sample with
little
you.
gift.
Just 90%. I'll tell people, bring me a sample. Hope they come back. But if you come with a little sample, it's okay. If we don't need it, we throw it away. It's not a big deal. But having that there is a good idea, especially in the cats, because they're the ones that, in the house, it's easy to catch a sample from those guys. Mm-hmm. Take something from the litter box, especially in a multiple pet household. We want to see that. And I'm sure everybody's using the heartworm preventatives, the flea preventatives, especially down here. So a lot of our protection is there. We want to make sure we have a healthy candidate here, and that's what we're trying to do. As far as I would say something to bathing dogs once in a while never really hurts. Medicated shampoo or basic shampoo at least once a month wouldn't hurt anything. Some dogs need it more frequently if they have skin issues. Mm-hmm. That's what we could address too. The skin looks red. Why's my skin? We do it once a week if we have to. Those are the things that let us know that the pet's doing okay.
Have you ever seen an owner that bathed the pet too much and got the skin dry too?
We have owners that do a lot of pet. Now, if it's medically done, therapeutically, yes, it's okay. Some dogs require. Some people bathe their dogs in every shampoo, every product out there, thinking it's helping the pet. That's not what we want to see and do. Same as us. We can't wash our hair like every 10 minutes, or it will definitely cause other issues. If somebody thinks they need to bathe them that often, why is the question? And that's where we come in to help them. Why are you doing this? There might be something else going on. That's where we put our expertise into effect. And as far as, like we said at the shelter, we do these dentals. We do these procedures periodically. We keep things in check. We're not doing advanced cardiac surgery. We're getting you so you don't have to get to advanced cardiac surgery and try to prevent it. If it's needed, we direct you in those areas.
Yeah, it's we do, what are we doing now? 2 or 3 days a week we're doing wellness appointments for owned pets, and they're just short appointments, and it's usually, like you say, just basics. We're helping people with, skin issues or ear infection type stuff, vaccines, heartworm tests, feline leukemia tests, just the real basics.
Try to alert people on the benefit of taking care of their pets and what they need to do with basic medications. And if there's something wrong, we could find it before it becomes something terrible. And that's what we try to do. And that's our mission in our shelter, and we feel what we do. And we're pretty successful at that. We've been very happy and lucky about that. Yeah. And sometimes we'll find things that aren't the best, but at least we direct the owner what to do and explain what can and can't be done.
Yeah. And lots of spay-neuter. Always spay-neuter.
If I had to say how much a spay and neuter is effective in animals,
Well, and I know we haven't talked about it too much, but, of course, as a humane society, we focus on the overpopulation issue of why people should spay-neuter. But there's also a lot of other reasons people should spay-neuter, even with some of the skin conditions, aren't hormonal can bring on?
It's a whole variety. There's a lot of schools of thought. Some say don't do it. I've seen less dogs having problems that are spayed and neutered than those that aren't in all my years of practice. It's, however you like. But those that do it, and even the ones that are vaccinated, I see less of those animals sick. The ones that aren't vaccinated running around, they get sicker or they never get better. Dogs that aren't spayed or neutered have issues later in life. And those issues usually become very difficult, if not impossible, to correct. And that's what we get. It's almost, to me, it sometimes gets a little depressing because I don't want to ever tell people what you should have done. And I can't do that. I'll never do that. But I look at it and I just say, okay, I cringe and hope I can get them over and better. But I'm at a point where...
If you get another pet, make sure they're spayed or neutered because you're losing this one to testicular cancer or
mammary cancer and things that you could avoid. And, we say, we'll help you along the way now. But if we didn't, we wouldn't be here having this conversation.
Yeah. Spaying and neutering can solve a lot of problems.
It does. And I mean... I would love to say people should visit the shelter and see how beautiful animals are. I impressed everybody about this. So it's wonderful. These pets are treated so well there. They have,
but they shouldn't be there.
They shouldn't be there, and we would like,
and people would spay neuter.
As people name, we have these poor guys running around. We do it, and we get them out, and they're not coming back from these, geriatric or what we call urogenital problems because they've been spayed and neutered.
Yep.
But the beauty of it, these animals are treated so well. They have such a great lifestyle. To get these guys home, sometimes I hate to let them go because they're so beautiful. I have such an affectionate bond with these guys.
We definitely get attached.
And it becomes perfect. It's wonderful. It's a wonderful experience.
Okay, Billy's saying it's time to take a break again. Welcome back to Speaking of Animals. So, Dr. Frank, thank you so much for all the information today. Hopefully people will do little mini exams on their pets and avoid having issues further down the road. So we appreciate your advice, and we appreciate Billy's input today. He's been my most vocal guest ever, I think.
Billy's wonderful.
He's good. He's fun. So we have some upcoming events I wanted to mention. We have another Coffee with the Cats. The last Coffee with the Cats had a lot of cats adopted, so we're going to do it again at the shelter September 28th. We're going to have our annual Halloween Yappy Hour, October 26th. That's going to be another fun one. The Halloween Yappy Hours are always fun because people dress up their pets, and we have a pet costume contest, and so those are fun. So October 26th, make sure you save the date. We have our golf tournament is going to be December 1st at Grand Haven, which is a beautiful course. So check out our website for golf information. We get a foursome and have fun. Do you golf, Dr. Frank?
It's wonderful if you go to the website because there are so many events happening at that shelter. I think it's more excitement there than happening downtown Daytona. But if you could look into it, it's very, very pet friendly. Even families just to go. If you don't even have to have a pet, just to show because they have a beautiful campus out there, and it's pretty wonderful. So I can't emphasize it enough. I'm sorry sometimes I miss all these events because there's so many of them.
Well, you avoided when I asked you if you golfed. You must not be an avid
I'm not a golfer, but I would love to go there and just hang out.
Well, you can come hang out.
I would love to be an observer.
You can come hang out. You could win the closest to the beer. They have we do a prize where we put some beer like in a bad spot on the course, and whoever gets closest to the beer, because that's usually like one of the worst players.
I'll be there.
So then they win the case of beer.
That sounds like
fun.
me.
It's fun.
But all in all, though, we hope that we just encourage people to have some ideas about their pets, and if there's anything at all we could be of assistance for, even if it's sometimes people come in with other questions and they want to refer things to us, please reach out to us. We can help you out.
Yeah, we try.
To give you a guiding line on what to do.
We definitely try. So, well, thank you, everybody, for listening today. Thank you, Dr. Frank. Thank you, Billy, even though he got a little out of hand, I think. Billy. He had too much fun. So come adopt Billy. He's ready to go home and play and be. He's just an all-around good boy. All right, everybody.
Thank you.
Thank you. Take care.